Hello friends and good morning to everybody. I'm myself Dr. Rupanjana. I'm a geriatrician and in charge of the geriatric department at Umkal hospital. First of all, let me tell you what is actually geriatric medicine. Geriatric medicine is a complete and holistic approach and an in-depth approach to elderly care. Elderly care in the sense care for senior citizens, anybody above 60 plus. Now, why do we tell 60 plus? Why this particular age group? This age group is because generally people tend to have the physiological, physical, emotional and mental changes of aging from the age of 60 onwards. But not necessarily it is limited only to 60 plus. Often people tend to age early, maybe by the age of 40 or 50. In that case also they would come under the ages of geriatric department. Now let me tell you what is the difference between the geriatric department and the general medicine. Geriatric department is not only medicine, it is also an all-in-all holistic approach towards the entire well-being of an individual. Not only via medications but also lifestyle therapies, cognitive therapies and counseling as well. Counseling brings me to a very important topic of the geriatric medicine, that is dementia. Yes, dementia is quite well known nowadays. Almost everybody is aware of the term, but not everybody knows what it actually means. Loosely, dementia is very well known as forgetfulness. But no, on the contrary, it's a very common misnomer. Not everybody who forgets has dementia. You might forget your keys, you might forget your wallet, you might forget your car keys, you might forget the number of your plot number. It happens. You might forget your daughter's parents' day. It happens, but not necessarily you have dementia. Dementia is not only forgetfulness, but also a drastic personality change. Yes, let me repeat it again. Not only forgetfulness can be called dementia. Dementia comes along forgetfulness plus a drastic personality change. So, what we can say is, if a person has a drastic personality change but no forgetfulness, he will definitely be dementia. But if he has only forgetfulness, but he is behaving very normally in his day-to-day life with his family members, with his children, with his friends, he more or less remembers his things, his personal belongings, and he is well aware of his hygiene and his quality of life, then he will not have dementia. So let me highlight it again and again. Forgetfulness is not always dementia. Please don't term your parents or the old people around you who tend to forget a bit more than the others as dementia. Only and only if that person has a drastic personality change which is a source of inconvenience to his daily life as well as to his family members, only and only then can you term the person as dementia. So this brings us to another very common question, immediate question I must say, that how do we differentiate between dementia and common forgetfulness? My rule of thumb is, sit down calmly with a piece of paper. Write everything down from your daily life, maybe starting from 8 a.m. in the morning since you've woken up till 11 p.m. at night when you're going to bed. Write down everything that you can remember since the morning. Yes, even those things which you did forget but you managed to remember later on. If you can write down at least 80% of that, then my friend, even if you forget throughout the day, you don't have dementia. But yes, if you forget and yet you can't write down, you can't remember even if you're trying hard, then yes, there is definitely a component of dementia. But even then there is good news. Not necessarily your dementia is a symptom of some brain damage. No. The most common reason of dementia is thyroid disorder. Yes, it's thyroid disorder and electrolyte imbalance, that is low sodium and dehydration. So, if you think that you are tending to forget more than the others, get your thyroid checked, get an electrolyte test done, and load yourself up with lots and lots of water, fruit juice, etc. etc. In spite of that, if you think that you are still forgetting more than the others, a lot more than the others, causing an inconvenience to your daily life and to your family members, then definitely come to me. I'll check you out.